So my son's surgery date is set. I knew he was gonna have to have surgery after he was born, but I did keep it a secret because it's not a real serious surgery. Well, it is kind of serious, but it's not that like serious. So, when he was born, I went to Women's and Children, and apparently they birthed a lot of girl babies, and he was a boy. And the people that was over him and the doctor in charge, when it was time for his circumcision, they weren't able to pull the skin back easy. They said they would have to pull it back forcefully, but when they tried to, he was uncalm and it started to bleed. So they said they stopped immediately. They brought him in. They told me when he hit 6 months, they're going to send a referral over, and he's going to have to go somewhere and get circumcised after 6 months, where they put him to sleep and do it, because they're going to have to cut, pull, stitch. So I went to the appointment today, and one of the doctors, she read my file, so she know about my 2020 baby, because that was the hospital where it all started off at. And that hospital is pretty small. I dealt with 4 hospitals in 2020. So she was basically telling me like the procedure about putting him to sleep and stuff like that, and how I couldn't be back there due to the fact that I had a situation in 2020, and they don't want me to kind of freak out. They want me to sit in the lobby, and they just want to let me know, come and tell me what's going on. They don't want to they don't want me to see him get put to sleep, because they think, it might trigger me and things like that, which is understandable. They told me the appointment, I'll have to check in the hospital at 5 in the morning. It'll be at 7. He can't eat after midnight. It is a few weeks away. Probably like a month and some change away. And they told me it was like an hour procedure, 30 minutes, and then I'll be able to see him after 30 minutes after the procedure. So, his circumcision is actually a common procedure. It's just basically when your baby boy, the tip is like not fully separated, and it's like tight at the top. They can't, it's not loose, so you have to wait till he get a little bit older and it gets a little bit more developed, and then they could be able to move it a little bit, but then they'll have to like do it like a little slice incision, pull it all the way back, cut the excess, stitch it, easy beasy. I don't know how I feel the day of, so we will be continued.